I'm Joanne Sanchez. We welcome you again to this week's edition of Your Active Life, your orthopedic educational community program. By my side, Dr. Raul Marquez.
Hi, Joanne. Hello, everybody, and thank you for joining us.
Our goal during this program is to provide you with some valuable healthcare information that will be beneficial for you and for your family. Dr. Marquez, you've mentioned herniated disc. What is a herniated disc?
Well, that's an interesting question. At the same time, it's something that I think I like to show exactly what a herniated disc. First of all, what is a disc? The disc is the cushion between the two bones in the back, as you can see here. This is the disc, and the disc has a lot of functions. Like I told before, one of the functions is the shock absorbing on the back, and also allows for a lot of mobility on the back. Now, herniated disc. The disc is composed of a material in the center part of the disc. We call the nucleus pulposus, and the outside of the disc, or the periphery of the disc, is the nucleus fibrosus. To make it in a very simple terms, imagine it's a donut, and the center part of the donut, the jelly part, is the one that is almost really like a jelly. When it breaks through, we call a herniated disc. It's like in this case, you can see the little red part. That is a herniated disc. A bulging disc is just an inflamed disc. That means that the jelly part is still within the confines, or within the crust, if you want it, as a jelly, as we saw before. So just to show everybody, that's exactly what a herniated disc looks like. This is a normal disc. Nothing happened here. And this is a herniated disc. This red ball here.
Looks like a bulging disc.
It's like a big bulging disc there. And what happened when the disc bulge pinches the nerve? So people think, well, I have a herniated disc, but that's what I have the pain. The pain is because of bulging disc, or because of pinching the nerve. And the reason why we have pain is not because we have herniated disc, it's because it's pinching the nerve. Once you pinch the nerve, then you can have back pain or you can have leg pain. That is basically the difference between bulging disc and a herniated disc. Mind you, both can have exactly the same symptoms, exactly the same symptoms. You can have leg pain or you can have just back pain. That's why it's important to know where the pain comes from. So, to know where the pain comes from, what we do is, obviously, we examine the patient. We make sure that's exactly what we think. Then we take some x-rays. So x-rays are very important, but most important, we take an MRI. You know, an MRI of the spine.
Now, the herniated disc, it could be an injury at any part of our back, from our neck to the middle to the lower.
That's right. Every disc could be herniated. The most common one, as you can see here, is the second very last one. It's between the fourth and fifth vertebra. And the most common in the neck is between the fifth and the sixth, what we call C5, C6, C because of cervical spine. And in the thoracic spine, they also can occur, not as common, and the symptoms are a little different. But the most common ones are in the lower back or in the neck. What
causes these type of injuries?
Well, the most common cause of a herniated disc is time. Believe it or not, the older we get, we can have some herniated discs. People in general, most of the patients think that they have herniated disc because an accident is number one cause. As a matter of fact, accidents are not the number one cause of this. They could be because we have a genetic predisposition that the disc is a little weak. And by the way, the disc is 90% is water component, and the rest is almost like a fibrous tissue. So it's very malleable. So with time, we lose some water on the disc, and that's why it can protrude. So number one is age. Number two is also vicious positions. If you sit for a long time, or you put your neck or work in the computer for a long time, you start having neck pain. You can have a herniated disc because of that. And obviously, the most common one is an accident. It could be in a sports injury, it could be in a motor vehicle accident, a fall, etc. But those are the main cause of a herniated disc.
And also lifting maybe heavy objects.
Lifting heavy objects is also a cause, or or it could give you an aggravation of something that you have like that before, because people think, well, you know, I broke my disc just by carrying a heavy object, unless that object is very, very heavy, is, you know, it ruptures the disc. But those are the most common causes.
And what can we do to help prevent these kind of injuries?
Well, that's also a very interesting question. To prevent these injuries, I always tell my patients, you know, the stronger, the fitter you are, the better. Fitter, that means, you know, doing exercises, keeping your muscle tone, the general muscle tone in good shape, the less problems you will have. Also, in the industrial medicine, how to lift is very important, because if you're doing repetitive motion with in a vicious position, and how to lift is very important, because I don't know, but if you've seen your doctor and it tells you, well, you need to lift with your knees, that means you have to squat down and lift to avoid a lot of pressure on the discs. Sitting for a long period of time, also avoiding that. If you can have some breaks, that also will help prevent those type of injuries. Being in the computer for a long time with the neck bending down, moving the neck, doing stretching exercises, strengthening exercises of the neck, the back, also that will help you. That will help quite a bit. In general, that'll be the best way, you know, how we prevent these injuries.
The idea that exercise makes arthritis worse is a myth. In fact, the opposite is true. Exercise stimulates the cartilage and absorbs nutrients and repairs itself. Choose the right low-impact exercises like walking and swimming, and make them your daily routine.
We had a question, Dr. Marquez. There's a question on sciatica pain, sciatica nerve. Could you explain a little bit more on that?
Well, sciatica is a very common term. In general, what sciatica means is leg pain.
Okay.
Now we need to find out where the leg pain comes. Sciatica is basically an inflammation of the sciatic nerve. What is the sciatic nerve? It's the longest, thickest nerve in the body. That's why it's very famous, I think, just because it's probably the longest and thickest nerve. But the sciatic nerve is a composition of these last 5 segments on the vertebra. They all come together and they come through this hole we call the sciatic foramen, and they run down to the leg. That's why when people say, doctor, I have sciatica, and so I need to ask him, I say, where does it really hurt? And the back of the leg goes down to the toes or just stops on the calf, and that tells me which part of the sciatic nerve is being pinched.
Is it also a numbness kind of sensation?
Yeah, the most common symptom is numbness or pain. Basically, that's what when most of the patients tell me, when I have sciatica, but I understand, but the reason is that we need to find out why it has sciatica. The most common cause of sciatica is a herniated disc, for exactly the same reasons that we were talking before, because it pinches the nerve. Yeah.